Our project focused on veterans with post-traumatic stress disorder, does screening for PTSD before prescribing opioids versus not screening reduce opioid disuse disorder. Within the scope of nursing practice, it is important for the nurse to advocate for his or her patient to receive appropriate patient-specific care regarding the patient's PTSD. The increasing number of veterans brings rising numbers of PTSD to the population. Patients with PTSD versus those without have a higher rate of misuse of prescription opiates.
The opioid epidemic in the United States is growing, and nurses are among the qualified healthcare professionals that can help prevent the opioid epidemic from spreading. Treatment of comorbid PTSD and opioid dependence has been a challenge for many clinicians. The veteran population is more susceptible to misuse and abuse of opioid medications.
Current initiatives are more focused on opioid addiction rather than the occurring PTSD and opioid addiction. The first study we looked at focused on identifying psychiatric conditions in addition to substance abuse disorder. The second study suggested that interventions targeting both heroin dependence and PTSD may help improve the outcomes of those with comorbid PTSD. Another study we utilized stated that opioid substitution therapy is effective at reducing substance abuse and PTSD. But additional services are needed for treatment of psychological problems that are largely unchanged by treatment for addiction. Additional services are needed to treat co-occurring PTSD and opioid addiction in order to prevent relapse or worsening conditions.
Improvements for screening and treatment of PTSD are needed to help decrease the incidence of opioid use disorder. Initiatives such as early screening, education, thorough patient history, assessing veteran status, and support systems are all things that nurses can do to help decrease the incidence of opioid use disorder. For individuals who are suffering from pain, alternative and complementary therapies should be utilized first, such as acupuncture, aromatherapy, meditation, and these can all be used in which nurses should be aware of. More studies need to be done on a larger population of veterans to gather more accurate data.
In conclusion, current initiatives are mainly focused on treating the opioid addiction and not the co-occurring PTSD and opioid addiction. There is a need for integrated treatment programs designed for individuals with comorbid opioid addiction and PTSD. Early screening for PTSD in patients at risk can be beneficial in helping decrease the incidence of patients receiving opioids. Nurses play a vital role in helping to screen and recognize patients at risk for PTSD because they are the first healthcare providers an individual sees. They perform health assessment and intake information, as well as providing referrals. Thanks for listening. Stay groovy.